will be muted. As we begin our discussion today, we open by honoring the Algonquin people on whose traditional unceded territory the City of Ottawa is located. We would like to extend this respect to all First Nations, Inuit, and Métis peoples, their ancestors, their elders, and their valuable past and present contributions to this land. The Ottawa Child and Youth Initiative, otherwise known as OCYI, is a collaborative of over 80 community organizations and agencies with a shared commitment to ensuring that all children and youth in Ottawa have the opportunity to reach their full potential and grow up great. Today's event is an initiative of the OCYI in partnership with Prevention Ottawa, Ottawa Public Health, the City of Ottawa's Recreation, Culture, and Facilities Services, and the Boys and Girls Club of Ottawa. The goal of this event is to provide critical hour programs such as homework clubs and before and after school programs with an opportunity to ask COVID questions related to their child and youth programs. Prior to the session, we invited you to send us your questions. This session will include expert panelists to answer those questions. Today's panelists are Dr. Sarah Erdman, a medical resident at Ottawa Public Health, Katie Pruzakowski, a manager for the Recreation, Culture, and Facility Services Department at the City of Ottawa, Medin Admasu, the Chief Programs Officer for the Boys and Girls Club of Ottawa, and Linda Cove, a public health nurse with the mental health team at Ottawa Public Health. A recording of this webinar will be available and posted on the OCYI website, www.growingupgreat.ca. We recognize COVID information is changing and our panelists will be providing information based on current knowledge. We encourage you to review latest updates and information on Ottawa Public Health's website. You may also join OCYI's mailing list for future events and resources at growingupgreat.ca. Thank you to all the participants and your questions. Some questions were very specific to unique programs or circumstances, and many had similar themes. To be as inclusive as possible, we will do our best to provide comprehensive answers that we hope you will find helpful. As such, we may not read your questions exactly as submitted, but we'll aim to address the key issues covering these themes raised. Dr. Erdman will begin our session with a brief COVID 101 presentation, followed by the question and answer period. If you wish to ask a question during today's discussion, please use the question and answer function in Zoom, not the chat. We will make every effort to answer as many questions and share the answers to those we miss after today's event. With that, we will now begin with Dr. Sarah Erdman from OPH.
Hello, everyone. Thank you, Danielle. Perfect. So I'm just going to give you a brief orientation to COVID-19 and some information that we at Ottawa Public Health would like to share with you today. So our purpose is to address you, the staff and volunteers of agencies serving Ottawa and youth programs in Ottawa, serving children and youth programs in Ottawa. And first of all, I want to thank you for your incredibly valuable services that you provide to our young people. The pandemic has caused us all to change the way we work and interact with others, and it is through your adaptability and commitment to the work that you do that will help us get all us get through it together. So Ottawa Public Health, in partnership with OCYI, is here to support you. So first, I'm going to start with a little bit about what COVID-19 is. Oops, sorry. So COVID-19 is a virus that affects causes an infection of your respiratory system. Typically, COVID is commonly spread person to person through what we call droplets. Respiratory droplets are coughing, sneezing, saliva, or through close, prolonged personal contact. You can also transmit COVID-19 by touching something with a virus on it and then directly touching your mouth, nose, or eyes before you wash your hands. Respiratory droplets are typically spread up to 2 meters. So that's why it's important for us to keep the 2-meter distance between people. So anyone can catch COVID-19. It's like catching a cold or the flu, but there are many people who have greater risk of getting really sick from COVID-19. Those at risk include older adults, anyone living with a compromised immune system, such as someone receiving cancer treatment or other medications, and anyone with an underlying medical condition, such as diabetes or heart disease. So it's important for all of us to do everything we can to protect our most vulnerable members of our community. And that means following the guidelines set out by public health experts. So these are symptoms of COVID-19. They're divided into tier 1 and tier 2 symptoms specifically for children, so anyone who's under age 18 years old. Tier 1 symptoms are fever, new or worsening cough, or shortness of breath or difficulty breathing. And if a child presents with any of those symptoms, we would advise them to self-isolate, and I'll discuss a little bit more what that means later, and to get tested for COVID-19. Tier 2 symptoms are those on the right-hand side, so sore throat, runny or congested nose, unusual headache, nausea, vomiting, or diarrhea, or extreme tiredness that's unusual, or extreme muscle aches that are unusual or unexplained. And if a child develops one of those symptoms, we would advise them to self-isolate and watch those symptoms for at least 24 hours. And if they're improving after 24 hours and they still just have just one of those symptoms, we advise them that they can then resume their normal activities. If they develop 2 or more of those symptoms, that's when we would advise, like the tier 1 symptoms, to self-isolate and get tested for COVID-19. I know that's a little bit confusing and it's a lot, but we have our daily school and childcare screening tool that would apply also to all children's programming. It should be conducted daily before sending children to programming school or childcare. And that school is up on our website, and it can help parents and guardians make the best decisions about whether their child can attend school or childcare. We also have a similar screening tool for staff that's specific for adult symptoms. So we don't have those 2 tiers of symptoms, and everything can be found on our website. So we recommend everyone does those screening tools daily before attending any programming or childcare. So I just want to let you know about understanding the risks of COVID-19. As we open up our community and engage in more activities, there are more interactions, and that increases the risk of transmission. We're all eager to get back to normal, but we have to continue to proceed with caution. So resuming activities with care and in keeping with public health guidelines. There's no such thing right now as zero risk in the midst of this pandemic. So we're focused on reducing the risk as much as possible and reopening things as safely as we can. Just trying to, next slide. There we go. Oh, sorry. There's a delay. I apologize for that. Just go back. Okay, so the province of Ontario recently released this framework, and you can get more details on it on the province's website. But I just wanted to show you this to highlight that we really need to be adaptable and flexible as we're going forward through these next few months. And we will need to scale up or scale down our public health interventions depending on certain indicators of the amount of COVID in our community. So right now, Ottawa is currently sitting in the orange zone, which is restrict, but we could quickly move to the red zone if we're not careful, especially over the next coming months with winter and people spending more time at home, or over the holidays with increasing gatherings, social gatherings or parties. So we want to be really careful, and our programs and businesses have to all be flexible and adaptable, unfortunately, at this time. Okay, so now I'll just talk to you briefly about what happens if someone tests positive for COVID-19. So we receive their contact information at Ottawa Public Health, and we have our case and contact management team contact them and interview them for the purposes of contact tracing and follow up to ensure that they are receiving also the appropriate care and self-isolation. Their information remains private in accordance with the Personal Health and Information Protection Act. Ottawa Public Health will contact and interview those to determine their high-risk contacts, and also then contact those high-risk contacts, those close contacts, to advise them of what to do. And we have more information about this again on our website. So the best way to protect yourself and others are following these 4 steps of being COVID-wise. So wearing your mask, isolating yourself when you're sick, staying 2 meters apart from others, and exercising appropriate hand hygiene. And I'll go through each of these measures a little bit more. So wearing a mask protects yourself and others. There's increasing evidence to suggest that wearing a mask is really beneficial to protect community transmission. Here in Ottawa, we have our mandatory mask bylaw. So that means that wearing a mask is mandatory inside public spaces. When I wear a mask, that's what protects you from my secretions. And when you wear a mask, that's what protects me from your respiratory secretions. So masks are required under the bylaw for everyone above age 2 years of age, with the caveat being that there are exemptions for children under the age of 5, either chronologically or developmentally, who are refusing to wear a mask, or those with certain underlying health conditions that would make wearing a mask impossible for them. So there's more information on our website about masks and how to choose one. There's also information about how to help children accept masks as well. So the best way to help your children accept a mask is by being a role model and wearing the mask yourself, explaining to them why we're wearing a mask, and giving them some choice in the color of the mask or design of the mask, and including masks in their play environment so that they're accessible and they can practice with them and play with them. So self-isolation. So what that means is when you've been told to separate yourself from others. So when you test positive for COVID-19, you are required to self-isolate for a minimum of 10 days to prevent the spread of virus. There are other instances of when you would want to self-isolate yourself, when you are required to self-isolate yourself. So if you are contacted as a high-risk contact of someone, that changes to 14 days of self-isolation. And that is to the longer period of time is to incorporate the incubation period. So that period before you get sick, when you are potentially spreading the virus. And so this is just a little example about how quickly COVID-19 can spread in our community. So this is an example of one person who was mildly ill, who attended a barbecue at a park with 40 other people, and quickly got someone else sick, who then took it into their place of work, which happened to be a congregate setting where people are more vulnerable. Another individual took it to their house, and then it quickly spread within their household, and then it was taken into a daycare where it quickly spread. All these blue dots, I should add, are confirmed cases of COVID-19. It spread into a place of work and also spread into 2 different schools very quickly. So keeping a safe distance of 2 or more meters when possible, and limiting our activities outside the home protects us from others' droplets when they talk or sneeze or cough. So this is a diagram from Ottawa Public Health about how to properly wash your hands. So we encourage rubbing and lathering for at least 15 seconds when you wash your hands with liquid soap, and then rinsing it off well. And for children or anyone to remember to wash their hands for at least 15 seconds, we would recommend them singing a song like Happy Birthday at least twice, not at least. So we encourage you to stay up to date and connected. There's a lot of information out there. So we encourage you to choose reliable sources of information like our Ottawa Public Health Twitter feed or Facebook, or our website for many resources about COVID-19, mental health, and resources in many languages, including English and French. And here's just some more resources. Thank you so much for your time. I appreciate you being here today, and I'll hand it back to Danielle.
Thank you, Sarah, and thank you again, participants, for all your questions. The first set of questions were related to in-person program, and they will be for Katie. Katie, what methods can be used to offer services to children and youth and families more safely? What tips can you offer for putting the regulations and guidance into practice? And I'd like to learn more about using outdoor sports equipment. For example, can we play catch with the ball? Is it okay to use equipment if hands and the equipment are sanitized between participants and uses?
Hi, everyone. Thanks for having me today. So in terms of modifying recreation programs to suit COVID guidelines, it is very challenging, especially for us in recreation where we work in such a hands-on industry. And we've really had to look at thinking outside of the box and being creative to come up with measures that are going to allow us to still run some level of programming while keeping that safety aspect in mind. So today I'm just going to go through a couple of little things to consider when you're looking at your programs and services that you're going to be running. So first of all, scheduling. So obviously we need to look at reducing our maximum capacities, both in accordance with the provincial guidelines, but then also looking at the specifics of your space and making sure that you're factoring how many people you can have safely within that space, allowing for that 70 square meters of space per person. So although according to the orders, you may be able to have up to 50 in your location, based on the space you have, your numbers might be significantly less. You also want to look at, if you're running multiple programs in a day, you want to look at starting and staggering your start and end times so that you're reducing the risk of different groups crossing paths with each other, or reducing lines and bottlenecking coming into the facility. For programming and activities, we're really focusing as much as we can this winter on outdoor activities. So the city is going to be launching a whole variety of programs that will allow participants to do their activities outdoors where the risk of transmission is so much less. So that's a really key thing for us this winter. Activities we're also focusing on are more individual versus team participation type activities. So for traditional sports, looking at skills and drills versus any type of gameplay where there would be close contact and shared equipment. For activities such as dance or fitness classes, you can look at marking spots on the floor, creating little boxes in the space so that it's very clear to all the participants what space is allowed per person, and you don't have crossing in and out of different bubbles. Um, Also looking at rolling out programs gradually and just kind of assessing how things are going. So over the next couple of months, we are going to be rolling out more programming options, but that's going to be kind of slowly over time until we reach the point where we've reached our, the level of programming that we're hoping to sustain. Let's see here. Excuse me. And then your procedures. So you're going to want to have very clear established procedures for all staff and participants to follow with respect to sanitizing any type of equipment or supplies that are going to be used throughout the programming. Have very clear checklists that identify what touch points, what equipment needs to be sanitized at different points, and having a staff sign off on those items. In the event that you do end up having a positive case, those records are really important to be able to provide to Ottawa Public Health. And you're also going to need to establish a mechanism for tracking drop-in participation. So for example, for swimming programs, for weight room and cardio, we're using a system called Front Desk, where clients are able to register for a specific time slot, where that would have been something they would have traditionally dropped in on. So just looking at what mechanisms you can use to take programs that are traditionally drop-in where you may not be tracking participation, and making sure that you have the opportunity to gather all the information that you'll need for any contact tracing. In terms of tips for putting safety regulations into place, I'm going to refer to the slides here where I've taken some photos of one of our locations just to show how you can set up your facility to encourage COVID-wise behavior. So this is something that was really daunting at first. So this might be able to give you some good tips and tricks for what you can do to set up your safe space. Okay. So in terms of entries and exits, when at all possible, you want to keep those separate so that you don't have people crossing paths with each other. So in this case, the main entrance is a set of double doors. There's not a lot of alternative entries and exits. At some larger facilities, you may be able to have separate entrances and exits for different groups, different participants. But in this case, there's the one point of contact, which is really the only option. So it's a set of two double doors where the right-hand side is for entries and the left is for exits. And you can see that there's pylons identifying where clients should go. There's arrows on the floor. And then what you can't really see in the photo is there's decals on the ground where participants can line up while people are entering the building so that they can still maintain that social distance. So this is the first checkpoint that participants will see when they enter the facility. You can't really see very well, but there is a barrier that protects the staff at this workstation. And this is where we do our contact tracing. We take the mark off people from our registration system that are there and check for any potential symptoms. Again, we use marquees and floor markings to indicate direction. There's another one, blocking off entries and exits that we don't want people to use. Sanitizer and clear signage. And these are examples of the decals on the floor.
Thank you,
In terms
Katie.
of equipment, did you want me to quickly touch on that?
Go for it. Thanks.
Yeah, so we're really avoiding programming where there is any type of shared equipment. So you can use things like soccer balls where there's not that touch with the hands. Otherwise, focus on things there, each participant would need to have their own ball, as well as any equipment that may be used and then passed on to another participant. You need to have clear areas where clean equipment goes versus used equipment to be sanitized. And that's all for me. Thank you, Danielle.
Thank you, Katie. The following questions, still related to in-person programming, will be directed to the panel in general, starting with Sarah from OPH, then followed by Katie and Madin. Is it recommended to stop all in-person activities this winter for all age groups? How can we create programs for youth without mixing schools together and continuing the spread of COVID-19? What are the COVID-19 precautions for preparing and serving food for participants?
So I can start with the first question. No, at this time, we're not recommending stopping in-person activities this winter. We really want to recognize that in-person activities are important for the growth, development, and mental wellness of our children. We really want to balance the physical and mental health needs of Ottawa residents, including our children and youth. But we're shifting our focus towards coexisting with COVID with care and ensuring that we balance the impact of COVID with our other considerations, like I mentioned. We need to do these activities as safely as possible, though. So taking a harm reduction approach, like I talked about in my presentation about with COVIDwise, wearing masks, hand hygiene, physical distancing, and encouraging everyone to stay home when sick.
Katie and Madin, anything to add to that?
One thing that we keep in mind, I know there is a lot of virtual programming out there, but in particular, the area where I work, we deal with a lot of priority populations where virtual programming is just not an option. So we do still offer in-person programming so that, we can be really inclusive to everyone.
Thank you. Madin?
Yeah, just the indoor option definitely needs to continue as much as possible, right? I think most agencies have provided some other options as well, like the virtual and whatnot, but we're trying to plan for outdoor as much as possible. And we do have things like access to a skating rink and space. And so making good use of that. But the community has been really responsive to the indoor programming since the summer. So we want to continue to do that. Do you want us to touch on the other questions as well?
That would be great.
So one way, I think the second question was related to the mixing of cohorts, or sorry, mixing of schools. And so one way that we've been able to avoid that is to create actual cohorts related to the schools themselves. And so we've had to transition and change as we've reopened from the fall, like in terms of the schools coming back. And so in our east location at Don McGann, we had 2 specific schools that are nearby that did include the majority of the kids that were coming to that location. We dedicated specific times for those 2 schools for the kids to come in. So it was only kids that were coming in from those schools. So if possible, separate your cohorts based around your schools that are near your locations. That's been very helpful for us. When we, in another location, we weren't getting the same amount of children coming as we would have anticipated. So we had to change the cohort. And this was at our South location where we noticed there was a few families that were together and they created their own cohort. So we engaged them to make sure that they were okay with being in their own bubble. And so we created a cohort around that bubble. And so COVID's taught us that you have to be flexible and adaptable as much as possible. Those are some examples of how we've been able to do that. And the food, I think, was, there was a question about food. Yeah, we focused on prepackaged food. That's been a difficult one for sure. And you'll see once you start reopening your programs, it's a difficult one to undertake because it's so essential to our programming, but prepackaged as much as possible, which is what OPH has guided us to do. And so, and partnering, we've partnered with a couple of businesses to make sure that we could provide that as an outdoor service or a service that goes external to what we do indoor. And so, yeah, you got to be flexible with the food piece. It's definitely difficult, but it's important.
Thank you. Thank you, panelists. The next question is for Sarah from Ottawa Public Health. Dr. Erdman, which is the best type of thermometer to use at programs? For example, is a thermometer you hold to your forehead or wrist just as effective as the in-ear type?
Thank you for that question. So the best type of thermometer is the one that you can hold it up to the forehead or wrist. We recommend that. It's called a digital infrared thermometer. It's at least as effective and reliable as the in-ear types. And in fact, it's actually much easier to use. It's more reliable because there is a wrong way to take a temperature with the ear type. So these contactless thermometers are easy to use. You hold them up, but the caveat is they need to be in the same room as the person who needs their temperature checked for around 30 minutes prior, because they are sensitive to ambient air temperatures. So that would ensure the most accurate measurement.
Thank you. The following questions are related to masks, and we will start again with Sarah, then followed by Katie and Medin, who will briefly outline the mask recommendations for their programs. So how far apart should participants be if both are wearing a mask? With the 3-layer filtered masks now recommended, is this something child and youth programs should now be requiring for all staff and participants? Are participants recommended to wear a mask outside for programming, even when everyone is kept 6 feet apart?
Thank you. So I'll start with the first question. How far apart should participants and staff be if both are wearing a mask? So we still recommend physical distancing. Wearing a mask is not an alternative to physical distancing. It's recommended that participants and staff make every effort to keep a 2-meter distance, even when both are wearing a mask. This is called layering levels of protection, and it reduces the transmission even further. In the second question I'll address now, the 3-layer filtered masks are now recommended. Whether or not you require this for your programs and staff is up to you. We are recommending that if you have a well-fitting 2-layered mask made of tightly woven materials, this is still acceptable. They work almost as well as a 3-layer mask for protecting those around you. However, if you're replacing your mask or buying a new mask, we do recommend you to look for a 3-layer mask where the outer and inner layer are tightly woven cotton or linen material, and then a filter type fabric is inserted into the 3rd or middle layer. And we always recommend a secure covering to fit the nose, mouth, and chin. And so for the third question about wearing masks outdoors, we do encourage people to wear a mask outdoors when keeping a distance of 2 meters is not possible. Current evidence tells us that the risk of transmission of the virus in outdoor settings is lower than indoor settings. Physical distancing is easier to maintain outdoors. There's much greater air circulation when outdoors, and that reduces the risk. The risk is though not eliminated outdoors, and masks help to reduce the risk even further.
Thank you, Sarah. Katie and Medin, was there anything to add?
No, nothing for me, thank you.
Just that you might have to change as you go along. Our guidance from OPH in the summer was very specific. We weren't including masks for children during the summer. We did for staff, and then in the fall we transitioned when schools reopened to wearing masks, especially if it's, I think the unique piece is when children and youth are actually in some, intense physical activity. When they're doing that, they're usually not wearing the mask, but otherwise they're recommended to wear the masks as well.
Thank you, Madin. Thank you, everyone. The following questions will be directed to Sarah to start, after which Katie and Madin can speak to their lived experiences. So why do some people have to self-isolate for 10 days and others for 14 days? What happens if a staff member or participant reports having tested positive for COVID-19? What happens and what steps need to be taken if a program needs to close? And what is the length of time for closures?
Thanks, Danielle. So some people have to isolate for 10 days and others are for 14 days. And this is a little confusing, so I'll try to clarify why this is. So if someone tests positive for COVID-19, they are required to self-isolate for 10 days from when their symptoms started or when their test was positive if they don't have any symptoms. Those people, like I mentioned earlier, will have high-risk contacts around them, typically members of their household or other people where they had close contact. Those people, through contact tracing, Ottawa Public Health will identify as what we call high-risk contacts, and we advise those people to self-isolate for 14 days. And now this longer time period is to take into account that first you have to get sick and then develop the symptoms. So that's what we call the incubation period. So the 14 days takes that into account as well. So what happens if a staff member or participant tests positive for COVID-19? So our goal at Ottawa Public Health is to prevent the further transmission of COVID-19 and to keep all the participants and staff safe. So if someone tests positive or develops symptoms, we will work in collaboration with the program and the facility to reduce the risk of COVID-19 throughout the program. So we will help the program and facility review and confirm their practices to reduce the transmission of COVID. We will provide recommendations on testing and identifying who is in close contact with the individual who tested positive, and recommend that they would self-isolate and go for testing if they are identified as a close contact. We would assess whether the program can continue and if any additional measures are needed. And we would be contacting those affected directly to provide direct guidance. So you would hear from Ottawa Public Health directly. And so what happens if a program needs to close? Typically, a program would need to close in the context of what we call an outbreak, which would be declared in a program if it's determined that there are 2 positive cases with a link. So those children or staff members could have become infected at the program, either from each other or from a common source. So each case would be assessed and investigated by Ottawa Public Health. And if a program is closed, we would reach out to any parents or close contacts to let them know what is happening. And we work again with the program to identify next steps and when the program would open. The typical length of time for closure would depend on the situation. Typically, we would allow a program to reopen when it's been at least 14 days, so 2 weeks, that have passed with no evidence of ongoing transmission, and there are no further sick staff or participants from the program. If any of those things were to occur, then the closure might be extended past 2 weeks.
Thank you, Sarah. Katie, we'll turn it over to you to add any context here.
Thank you. So this is where it's very important to have really, really accurate records that you can kind of pull up as quickly as need be, so that you can quickly identify any other close contacts that may be notified. What I've learned through our lived experiences dealing with some positive participant and staff cases at some of our facilities is that it's not going to look the same in every case. There's no A, B, C, D to follow. For example, one site I was at where a staff member tested positive because of the nature of their job, the fact that they had no close contacts because of all of our cleaning and PPE, there was really not a lot that needed to happen with that case. Whereas in other situations, the type of program, the role that the staff plays, all of that will contribute to the Ottawa Public Health response. So unfortunately, there is no cookie cutter solution for what happens once somebody tests positive. And really, it's about working very collaboratively with Ottawa Public Health as they identify what actions you need to take. That's all for me. Thanks, Danielle.
Thanks, Katie. Medin?
Sure. So, yeah, I guess just following up on what Katie said as well, there isn't a cookie cutter approach really, but the key with this is being prepared ahead of time. So with Ottawa Public Health, we were able to create, I think 35 page document that just reviewed all the different things that we needed to be ready for. So that meant having an isolation room, what to do when a staff tests positive, or what to do when a member, one of the children and youth that you're serving tests positive. So we had to do that work ahead of time. And so for almost 3 months, 2.5 months in operation of indoor programs, we were able to avoid having a positive case. But once we did have that case, we did go back to our documentation, looked at with guidance from OPH about how far back we had to look. That was really key. So we were able to track from when the person first started showing symptoms and looking at who they were around during that time. And the way we set things up was to have separate cohorts. So that helped reduce some of the risk in terms of who you'd have to contact and who you'd have to follow up with. I mean, the demands on OPH, as we all know, is extremely high. And so as much as you can do to help support that work, you do. So communication with our families, with the children, youth, the members was really key. And even out to the public, we even had to post on social media to let people know, just in case those that did come into the center that we might have missed, which I don't think we did, but if we did, at least we gave that communication out to people. So preparation and communication around what happens is key.
Absolutely. Thank you, Medin. And thank you again, panelists. When programs are unable to run in person or are forced to close, many try to switch to virtual programming. The following virtual programming questions will be directed to Medin. Medin, what is virtual programming and how can we adapt what we have typically done in person to virtual? How does virtual programming compare to in-person programming? What virtual tools can be used to create a strong participant experience? How can virtual programming offer physical activity and social connection during COVID-19? And how can we deliver programs to those who do not have internet access?
Okay, good questions there. So yeah, we'll definitely talk virtual. So there was 3 different things that we were offering at this time. So virtual was definitely one piece where we had to shift from in-person to online. We asked, the way we did that was we asked members to identify what supports they needed. This was way back in March, early in this year. I'm sure most people can't remember back then, but we had to ask what did they need. So quickly, and which I think I've seen a lot of different agencies do, is create Zoom programming. So just offer whatever you could in terms of having some sort of service online. There were some other things that we did in terms of in-person program. We made sure to have that as well, and community outreach. So I think I'll touch on both of those second 2 pieces later. I think I have control now of the slides. Yeah, perfect. So adapting, so making sure you offer different kinds of options for communities. You don't know where families are at in terms of what they're willing to do in terms of giving them access to other people again, beyond their own families or their own bubbles. So you'll see in this slide, there's just a variety of ways that we had to do this. So I'll just keep going to get to the virtual piece, which I know everyone's excited for. So what is virtual programming and how can we adapt? So it's an alternative model of delivering the same or similar programming for individuals you serve, but online. So in our case, our children and youth said, we want the same staff, we want the same programs, and we want that delivered now. And so as you all know, our children and youth workers are not necessarily the trained in tech services or providing, our programming through this online platform of sorts, but we had to pivot. And so we did do that. It gave us a way to stay connected with members and to help them deal with their own isolation from their own communities, their families, their friends, and their school. At the beginning, it was all about live virtual programming. So using Zoom as a platform and doing things like we had a CrossFit program, trivia game, board games nights, and some regular programming that we offered in-house. And so being able to offer that in this alternative model is essentially what we did. It wasn't creating brand new programs. It was just trying to find ways to showcase what you're doing already through this platform. Other things that we did initially, as you see on the screen, this was an initial layout of what it could be. So same as other programs that we do, our in-person ones that we all do as agencies, we provided a schedule for the community to pick and choose from. And there was a lot of lessons we learned from this initial launch. So what you're seeing on the screen there is what we did from March till June as the initial reaction and response to still serving community during the initial impact of this COVID pandemic. So we transitioned from there to creating a platform. So question about how does virtual programming compare to in-person programming? So as one of our senior managers says all the time, 1 virtual minute is like 10 in-person minutes. Content can be delivered much quicker, but more prep time is required to fill up the same amount of time in person. Recruitment consisted of lots of phone calls, mass emails, social media blasts, word of mouth with community partners. You know, the communities that we're serving, they're not accustomed to this kind of programming, right? They're coming to our spaces to engage with us, engage with our workers, engage with the spaces and the activities that we offer. And so doing this in a virtual way has been a big shift for us, but it's still, what we've learned is that we can still provide a similar type of program, maybe not the same amount of time because nobody wants to be on a Zoom call for over an hour, 2 hours, 3 hours, but we do want to make sure that they still get access to the kind of programming that we used to do. Attendance varies. It depends on what else is out there. Of course, in the summertime, attendance definitely dropped significantly. And then in the fall, when school came back, it started slowly to come back up because people want to see their friends again and they want to see the people that they're used to working with. So you definitely have a different type of competition in terms of providing programming online. Often we talk about YouTube as a competition or Netflix, but one of the big learnings has been that the children and youth want to see the people they're familiar with. And so as long as those are the folks that are delivering the programming, you're already ahead of the game in terms of being able to connect and continue to connect with them. Other things in terms of differences in person to virtual, numbers are definitely different. You know, we'll have some programming that can get down to 3, 5 children and youth involved to up to 40, 45 kids. And that's usually related to a special event, or we have a leadership program that's Leaders for Life that has about 30 of our youth that come on a weekly basis. And so depending on what you've had existing, and if you could encourage the existing, transition the existing group from your in-person one to one where you can do it online as well. Ratios are different as well. So I'm getting to that. Oh, yes. Okay. A few lessons learned in terms of providing virtual. Face-to-face connections were important. New youth joined, showed us that the pandemic left everyone with a great need for connection. The more interactive and playful the programs, the more youth joined. So be super, super enthusiastic and excited. Not necessarily as I'm doing now in this presentation, but that was one of the big lessons that we learned. We did do an evaluation to see what were the positive experiences and the things that we needed to change. And one of the big lessons learned was you need highly engaged animators that are delivering the program to keep the children and youth involved. Other things that we learned. So there's some challenges related to virtual. So drop-in style activities didn't work so well. So making sure that the programming content on the virtual is very specific helps in terms of continued involvement of the youth. And that way, it's not just people know what they're signing up for and are engaged during that time, as opposed to a drop-in model that might work better in person. And then tech burnout. So making sure you incorporate time for breaks in between, even on a call like this, to make sure that there is some time for the kids to, go grab a snack or go get some water, stretch. If it's not a physical activity program that you're running, you need more breaks in it because of this. This platform is different. It needs different supports. And then keeping content fresh. So we have groups of volunteers that are constantly giving us, uploading PDF files, videos things that the children and youth can keep going back to when on their own time or even during programming. So making sure that's fresh, and that's a very important piece as well. I think I'm okay for time. No, not yet. Oh, there we go.
Thank you, Madin. So our next questions are related to mental health, and they will be for Linda, followed with Madin, who's going to answer the last question as well. So how can we help children to cope during the pandemic? How can we support the mental health of staff, or as a staff member, how can I practice being resilient? And what can we do to help children and youth stay socially connected?
Hi, thank you very much, Danielle, for those questions. So I think one of the things that we need to remember during the pandemic and this challenging time for many people is that children are going to experience emotions as well, and we're being challenged, and so are they. So we have to be patient. We need to realize that they're experiencing different emotions than they may have, and that this is normal for them to feel different emotions and to feel perhaps more emotional than normal. So one of the ideas is to just basics, spend some time with them, depending on their age level, chat about how they're feeling. And if they don't want to, which sometimes is the case, then being with them and just allowing space that they can talk. If they want to go for a drive, sometimes they'll open up if they're not looking at you and they're sitting in the car with you. So allowing them to express their emotions is important. Being patient with yourself and your children, of course, is important, more important during these times. So trying to stay calm. Also helping them to learn stress reduction techniques as well. You'll find many of these resources available on our website. We have a great mental health and COVID-19 website where you'll find multilingual resources, you'll find different videos, and you'll also find links to supports in the community. So, try things like stress reduction, things like deep breathing. Something as simple as that can be taught to young children. Meditation even is something that can be taught as well. You can learn together. Routines are really important, so get back to basics if you can. Children will benefit from a stable routine, going to bed, getting up at the same time. Healthy food is really important, and of course, getting some activity helps all of us, including children, to feel better. And if you're finding that your child or you do need help, there's lots available in our community. The slide up now talks about a new service available in Ottawa called Counseling Connect, as well as the walk-in counseling clinics. So we have some amazing resources in our city. We just need people to know where to reach out to get them. So our website has a list of every available resource for mental health, and you can print it off, you can post it at your site, and help people to find services within the community. So make sure to look at this, check it out, and reach out to those resources when you need them.
Absolutely. Thank you, Linda. And now, Madin, can you speak to specific examples of outreach to help youth stay socially connected during the pandemic?
Sure. Yeah, just following up with Linda's points there. So how to do that? I mean, one of our biggest lessons learned has been diversifying the way we reach people. And so in the past, we would open our doors and people would come, and fantastic. Now, even though we've had an outreach service in the past, we've had to really expand that, and being able to find where people are, right? Where people aren't, we're not seeing people in the schools enough. We're not seeing people out in programming because a lot of us have had to be closed. And so just as a specific example, we partnered with Ottawa Public Health and the City of Ottawa to do the Neighborhood Ambassador program, where we're getting young people out, talking to other young people in parks, in neighborhoods, in wherever they can find them, to be able to share that information specifically around COVID, specifically around what still exists, what is out there, what services are available. And it's expanded, and we're working with the different community agencies to make sure this information is there and we can continue to do this outreach work. And so I guess the biggest lesson has been about diversifying the way we reach young people because they can't be in the normal spaces. And so we're going to malls, which is part of the normal spaces. Some of the malls being open, we're finding them there. We're finding them still at outdoor basketball courts. We've been blessed with some good weather, maybe not today, but generally we have. So there are people out there and that messaging, even though we see it on social media and other places, the face-to-face messaging we're seeing is significant, and we're able to have those kind of conversations and just reconnecting where children and youth are. And so I think that's probably all I need to say about that. I'm sure we need time for some questions too, right?
Thank you, Madin. Yes, and just a reminder, we do have a few minutes left. So on the bottom of your screen, there is an icon that says Q&A if you want to ask a question there of our panelists. We did get a question earlier, so thank you for that. What are the maximum number of participants for indoor activities? Does it depend on the size of the space? Maybe Katie, I can pass that over to you because you did mention, you talked earlier a little bit about size, maybe just reiterate that one, please.
Hi. So yeah, although right now the provincial orders state a maximum capacity of 50, that also is dependent on the space that you have. So basically, I believe the calculation is 70 square meters per person. So you'll need to look at the square footage of the space that you have and make your calculations accordingly. And it's also important to consider that that includes both staff and participants. So you may need to have a slightly lower number of participants in order to have the required staff on site.
Thank you. So I'll pause for a moment just to see if there are any other questions that pop up. And if not, then I can always ask the panelists if there's anything, because I know they gave us a lot of information, if there's anything they just wanted to highlight or reiterate as a final thought. Oh, just got a question. Our center is using TikTok to reach youth. Is there any literature that can be shared around the best practices for privacy? That's a great question. I'm not sure if we'll have the answer for it today, but if not, we can always look into it. But maybe, Madin, do you have any thoughts on TikTok and privacy? I don't know if that's something that you've used.
Yeah, so we're not using TikTok in terms of our virtual platform right now. But in terms of privacy, I'm just looking for our wording. We did have to create like a new sort of code of conduct specifically for how we create online programs. So we could share that kind of, that tool that we use. It was very specific to virtual space and programming. So that helped.
Perfect. Thank you, Madin. I'll connect with you for that. I also had another question around the food preparation, and it was specifically asked to Ottawa Public Health. Would it be okay for participants to make food in our kitchen if they are alone and hands are washed? Example, and is it okay for program staff to prepare and serve food? Thank you.
So we are not at this time recommending that young participants, children, be involved in the preparation of food at this time. However, staff are able to be involved in the preparation and serving of food as long as it's done very carefully. So hands are washed before preparing food. Staff are involved in serving individual portions to the participants, and participants are physically distanced while they're eating. We don't recommend the sharing of cutlery or utensils or condiments like ketchup being passed around. Those should all be individual servings. I hope that helps.
Thank you. Another question we had was, do we have samples of operating procedures that could be shared? Katie, maybe I'll pass this one to you, and just wondering if there's examples, or maybe we can work to share some of the procedures that the city may have put together for their programming.
So that's going to be something I'll have to circle back to you on, whether those are things that we can share at this time.
And if so, then maybe OCYI can put something up on their website, or I can follow up after the webinar with that. Thank you. Madin, did you want to add anything?
Yeah, and yeah, we do have our preparedness document, which helped guide our training and preparation. So that's on our website right now. I was trying to scramble. I'll try to look and share it in the chat. If people want to just click on that, they can access it that way.
That would be great. Thank you, Madin. Next question, maybe Linda. Is there any tips for talking to young teens about mental health, especially those who are not likely to follow up with professional resources or are feeling scared or sad?
Sure. I think it's a great question, and I'm trying to get my video, but there it is. I think it's a great question. It can be a big challenge, especially for teens to talk. I think you need to set a good example and perhaps be a role model. So if you're comfortable talking about mental health, that of course will help your child feel more comfortable. We actually have a video on our website about how to talk about mental health. So if you go onto the mental health page at Ottawa Public Health, you'll find a video about talking about mental health. Another idea is, if you're really concerned, is to offer to go with your child, your teen, to a walk-in counseling clinic. They're amazing at what they do. And just being there with the child, you don't have to go in with them, but just offering to go, and just sit with them while they wait to talk to a counselor can be really reassuring and helpful. So it's really important that you have those discussions. As a parent, if they're struggling. So, be patient, allow them space, but do talk to them. Maybe watch the video for some tips on other ways you can get them to chat about their mental health.
Thank you, Linda. So I have, Madin, did you want to add something?
Just from what Katie and Linda said earlier, don't over-program your folks at the beginning, right? Like, that was something we learned from the summer. We just opened the doors to make sure we, reminded each other of who we were and what we can provide. So don't go heavy on the programming up front. Let that come later. Now in the fall, we're able to do specific programming because people are comfortable with that again. And so that's, just a reminder.
Perfect. Thank you. I have a clarifying question for Sarah with regards to the thermometer. The thermometer has to be in the same space as the person for 30 minutes. That was the question. It seems too difficult to wait for 30 minutes for a person to be inside to measure temperature. If it's too cold outside, the thermometer doesn't measure correctly. What other options do we have to do this appropriately?
Yeah, so if the thermometer is outside, it will not measure the person's temperature correctly, especially now in the winter months. As it's getting colder, that's more of a challenge. I think from a practical point of view of how to do this properly, it doesn't have to be, in the same room as the person, just at the same roughly room air temperature as that person. So if someone is coming in from outdoors to have their temperature checked, they would have to be, they could come indoors to have their temperature checked. But yeah, just don't bring the thermometer outside. I hope that clarifies your question.
Thank you, Sarah. And then another question that I have up is with regards to snacks that are provided by a food bank. Is it safe to send someone individually portioned leftover food? Does anyone want to take an attempt at that one? And if not, we can also look into that as a follow-up following the session.
I think that if no one has been around that food, no one has interacted with that food or sneezed on it or been served it, then yes, it would be safe to send individual portions home with participants. If any food is on an individual's plate and has been served to them, then that should be discarded.
Thank you, Sarah. And I think that wraps up all of our questions for right now, which is great because our timing is coming to a close. So I just want to thank all of the panelists again. Thank you to all the participants today. On behalf of OCYI, we really appreciate your questions and your time today. Following the event today, we will be reviewing all the questions asked through Zoom, and we'll share any answers that we missed. If we did miss any, I apologize in advance, but we'll follow up. And as I said, we will post the recording for today along with some of the questions on our website, on the OCYI website, which is www.growingupgreat.ca. Thank you to all of our partners for your support and expertise. They are appreciated and valuable. Thank you to Crime Prevention Ottawa, who helped us host the Zoom today. So with that, I hope everybody has a great day.